Multiple COVID-19 variants are circulating globally. In the United Kingdom and few countries, new variants have emerged with an unusually large number of mutations. However, there is currently no evidence that it causes more severe illness or increased risk of death. That is our focus on sound health this week. I am Olasumbo Modupe. Welcome to the show. We bring you COVID-19 updates. Please stay tuned.
More than 2,800 scientists from 130 countries have met to identify knowledge gaps and set research priorities for vaccines against SARS-CoV-2, the virus that causes COVID-19. At the WHO Virtual Forum, they discussed the safety and efficacy of existing vaccines and new candidates, ways to optimize limited supply, and the need for additional safety studies. Experts agreed on the need for critical research on administering vaccines in different target populations, as well as on vaccination delivery strategies and schedules. This includes trials, modeling, and observational studies, all of which will help to inform policy. More than 30 million vaccine doses have already been administered in 47 mostly high-income countries. But the global vaccine rollout has exposed glaring inequalities in access to this life-saving tool. The meeting concluded with agreement to establish a WHO-hosted platform for global sharing and coordination of emerging vaccine research information on efficacy and safety. The Nigeria Center for Disease Control has announced the inclusion of the Federal Medical Center Niger State to the Molecular Laboratory Network. Testing at any lab in the NCDC network is free of charge. To curtail the spread of the second wave of the COVID-19, Lagos State government has commenced full decontamination of offices in the State Secretariat Complex and other government offices. Permanent Secretary, Office of Environmental Services, Ministry of the Environment and Water Resources, Belinda Odeneye stated that the exercise had become necessary to reduce the risk of the spread of COVID-19 in the State Secretariat. She emphasized that the state government will continue to adopt measures as part of the safety protocols to ensure that the pandemic does not further spread in the state. Odeneye said the decontamination exercise, which commenced on Friday, 15th January 2021, is expected to end on Saturday, the 30th of January 2021. In addition, officers on grade level 1 to 14 are still expected to work from home till the 1st of February 2021. Also, stakeholders in the built environment have been urged to adhere strictly to the guidelines relevant to building construction sites in order to prevent the spread of the virus in the state. The Commissioner for Physical Planning and Urban Development, Dr. Idris Salako, in a statement, said it had become expedient to provide additional directives to prevent the spread of the coronavirus disease on all construction sites. He warned that any defaulting construction site will be penalized heavily and enjoined the general public to explore the online portal for the processing of their planning permits and other services of the Ministry of Physical Planning and Urban Development. Over 110,000 confirmed cases and more than 1,400 deaths have been reported in Nigeria and globally. There are above 93 million confirmed cases of COVID-19, including more than 2 million deaths reported to the WHO.
It's still Sound Health on Lagos Television. Today, with the expertise of Dr. Gbolagade Adewuyi, we will understand the new COVID-19 variant. He is a consultant clinical microbiologist with Uro Specialist Teaching Hospital, Uro. Welcome to the show, Dr. Adewuyi.
Thank you.
Okay, Dr. Adewuyi is also a senior lecturer at the Ambrose Ali University, Ekpoma, Edo State. He's joining us from Edo State via Skype. Is there truly a new COVID-19 variant, and how is it different?
There is actually a new COVID-19 variant. It's different because of mutations that occur at the receptor binding domain of the spikes of the virus. And there are about 23 different mutations that occur. 6 of the mutations are actually synonymous, that is to say, it does not result in change in the amino acid that is attached in the sequence, whereas 17 of those mutations actually are non-synonymous, that is to say, it's associated with change in the amino acid. And of the 17 that are not synonymous, 4 are actually the deletion mutation, while the remaining ones are non-deletion mutation. And of most importance to us is the mutation at location 5.1, which resulted in the change in amino acid asparagine with tyrosine. And this is associated with increased avidity of the virus to the receptor. That is to say, it makes the virus particle to bind more to the receptor of the human being. And that receptor is what we call angiotensin converting enzyme 2 receptor. And that is what triggers the infection and the problem that's associated with the virus.
Okay, does this new COVID-19 variant transmit more easily?
Yes. What has been established is that it's more readily transmissible than all others. But there is no clinical evidence of increased severity or lower severity or virulence. The only thing that is established is the fact that it is more readily transmissible.
Okay, public health authorities in Colorado detected a variant that was first identified in the UK in a person who reported no travel history. The lack of reported travel history suggests this variant has been transmitting. Can you please tell us more about this development?
Right, the variants were first detected from a blood sample collected in September this year in UK, and the test was eventually carried out in October, and it was then that it was established that there is a new variant, and evidences have shown that the same variant has spread and is the major cause of COVID-19 in UK and neighboring countries like France, and it has spread to other nations like Canada, Australia, and many this variant of concern, which is referred to as E117, which is domiciled mainly in UK. We have other variants like the one in South Africa. They have the same mutation N501Y, but evidence has shown that the source, that is the lineage, are not actually they are not the same. And these are not actually a new thing in virology, because what we know is that it's part of the adaptive measure of every living organism for survival and for increased transmissibility in virus, for them to mutate, that is to increase their adaptability to the environment so that they can sustain their lineage or existence. So it's not a new thing.
Scientists say the variant was found early in August in Nigeria. How true is this? Is the virus already in Nigeria? Is this new variant already in Nigeria?
Well, we cannot say it's not in Nigeria because people move in and out of Nigeria to UK. But the problem in Nigeria is that we don't do enough sequencing. So it's a nation where they do sequencing, they take the virus, they sequence the genome that they can actually establish. So there are speculations that it's in Nigeria, but there is no scientific evidence that it's here. But if we can increase our surveillance, especially genetic surveillance, by sequencing the genome of the isolated virus, I think we can detect it in Nigeria.
Okay, Dr. Adewuyi, is this new variant of COVID-19 virus behind the surge in cases?
Yes, apart from the new variant, the old variant is also at the present second wave of the pandemic. The reason is that as a result of reopening of all the institutions, people have let down infection prevention and control practices. And up to now, you'll be astonished to see that some people don't even believe that there is COVID. So as a result of negligence and increase and people are no longer using face masks, we are no longer observing social distancing, so this makes it easy for us to have this new one. This part of the speculations when we wanted to end the lockdown, we are expecting it. We know that it's likely to be one of the consequences of negligence or the letting down the book of lockdown.
Okay, is it too early to predict the virus is going to make recently developed vaccines less effective?
No, we cannot really say that. The available vaccines, the mechanism of action presently as a result of investigations are not actually altered. There is what we call virus escape. There is no established virus escape from the available vaccines and even the therapeutic medications that are available. So we cannot say the mutation or the new variant can actually render the vaccines useless. We can't say that.
With the recent emergence in the African region of new COVID-19 variants, which seem to have higher transmissibility, the World Health Organization has called for greater surveillance. What strategy should be in place to surmount these developments?
Well, one of the things we need to do in this country and Africa in general is to strengthen our laboratory, especially molecular surveillance, where one, the manpowers are not available, and where the manpower are available, the equipment are not available. And for us to actually do this, we also need very good power supply, which is one of the major problems we have in Africa. Nevertheless, there are centers like our center here, Neuro Specialist Teaching Hospital, and other centers in the country where we have stepped up measure towards surveillance and rapid detection of the new variant.
Okay, what measures can be put in place to check the spread of the virus while we await the arrival of the vaccines?
Well, while we are waiting, the most important thing is to go back to the infection prevention measure. One, ensure social distancing, not less than 2 meters between your neighbor, especially people who are not members of your household. Use your face mask and hygiene and observe all of etiquette. With this, I think we can actually contain the spread of the virus.
Thank you so much, Dr. Adewuyi, for your resources and time. We hope to have you on the show soon again.
You are welcome.
All right, that has been Dr. Gbolagade Adewuyi on multiple COVID-19 variants currently circulating the globe. Dr. Gbolagade Adewuyi is a consultant clinical microbiologist with Uro Specialist Teaching Hospital, Uro. He is also a senior lecturer at the Ambrose Ali University, Ekpoma, Edo State. Sound Health continues with trending health reports. Please stay tuned. This is where we wrap up today's episode on sound health. Please stay safe by washing or sanitizing your hands, wear your face mask, and embrace physical distancing at all times. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.